Qatar hit the right chords. There's so nicely said, looking at the micro level when it comes to science, the modalities, the areas and therapeutic areas that people are concentrating. I come from, as Professor Ingrid, you said very early, and like how we transition the digital into pharma. And I look at it from a little macro level. So we do see that companies will now require to operate with lower cost and really, really shorter timelines while maintaining quality and still encouraging innovation, which that is the key mission. And that for most of the biopharma, whether it is a smaller biotech, clinical stage biotech, or even a large pharma. So continuously, I'm seeing that my clients are reimagining how to work digitally, how to work in enabling the digital in their organization. In looking at the macro level, the elements that I see that the trends are definitely an evolving world order change, which is because of the conflict in Ukraine and the Middle East. There is a lot of change in supply chain, both in clinical and commercial supply chain disruptions. That will bring um, lots of digital imperatives in the area of clinical manufacturing as well as commercial manufacturing, how the sites are operated, how the plants are set up, how the materials are actually shipped and managed across the supply chain there. And finally, I do see a huge imperative in evolving technologies like AI and democratization of AI in the entire value chain, even in the how molecules are designed, molecules are produced, molecules are qualified, as well as all the way towards the end, how AI and generative AI is going to help traditional pharma to be able to author the CMC as well as regulatory dossiers for FDA submission. How fast? How can they beat their competition in developing those dossiers and generate them faster is also a great use case for AI. C is there is a strategy of diversification of the tech and clinical capital to enable geographic insourcing of materials, where more and more we are seeing that our clients are looking to do localization of their APIs and biosubstances and production, and to enable smaller plants, setting up smaller plants in locations which are more feasible in terms of resources, more feasible in terms of, again, supply chain, the entire supply chain route. You can mobilize them. And also the data laws for that particular country, the local data laws, which are more inducive and they are more fit for purpose for the